Welcome to the Health Channel, All Health, All the Time. I am Cynthia Demos. Prenatal care is important for a healthy pregnancy, allowing doctors to assess risks and keep both mother and baby safe. Joining us now to talk about this today, not one, not two, but three doctors, and you're not seeing triple, they are triplets here. They are great doctors, Dr. Victoria Bedell, Sarah Bedell, Joanna Bedell, all OBGYNs at Baptist Health South Florida. Doctors Bedell, thank you so much for being here.
Thanks for having us.
And they are absolutely lovely, wonderful, from South Florida, work here together, practice. You have a practice together?
Yes.
That's great. You must get along very well.
We do.
Okay, good for them, their parents, and their patients, of course. So you are becoming some regulars on the shows here. We know a lot of people love seeing you. Write in, call in, why not? Give us a little bit of background on your work, though, and how the three sisters here have become OBGYNs together. Give us the story.
So believe it or not, our parents are also OBGYNs.
I believe it.
So that's a little bit of how things started, and we were very interested in medicine early on, and it just kind of happened this way. And when we were deciding, finishing up residency and what we wanted to do, why not come back to South Florida? We had a lot of connections already just from our parents, and so it worked out. And now we practice together with our mother, actually.
Oh, that's so great. And did you go to medicals? Did you go to college together and medical school together, or how did that work?
Not quite. So we did all go to college together. Vicki and I went to medical school together at UM, and Sarah went to NYU.
Okay. Mm-hmm. Why go rogue?
I don't know, wanted to do something different, but it was a great decision. And then we all did our residencies separately and then came back together.
Awesome. Well, congratulations. I'm sure your parents are very proud. We're proud of you also. We're so happy to have them here today. But we do want to talk about a lot of important topics when it comes to having a baby. We are going to be talking about prenatal care, which is the health care women get while they are pregnant. The Department of Health and Human Services reports less than 10% of women receive care late or not at all, but women should be receiving care throughout the entire pregnancy. Tell us about that and why it's so important.
Yes, prenatal care is essential to a healthy pregnancy. Even if you're already healthy to begin with, there are a lot of other health issues that can start during pregnancy, and it's important to keep track of that. Patients ask us that all the time. Well, I'm really healthy. Do I really have to come in? And we are checking blood pressure, checking on the baby. There's always two patients whenever they come in and making sure that everything's good. And as things develop, they actually might even need to come in more frequently and make sure that everything is still going well, depending on the condition. Okay.
As we get into our discussion, I do want to take a moment to let our viewers know that you can call in if you have any questions. The number 855-796-4475, 855-796-4475 for doctors. Can we just call you Dr. Victoria, Dr. Sarah, and Dr. Joanna?
Yeah.
Okay, all right. It might be a little easier.
That's what our patients do.
All right. A healthy pregnancy can start before the pregnancy. So let's talk a little bit about preconception. How much does a woman's lifestyle before pregnancy affect the health of their pregnancy?
So there are several kind of factors that can affect that. Mm-hmm. Certain things to be mindful of is definitely maintaining a healthy weight, healthy diet, and quitting smoking or trying to stop smoking, because those are actually things that can make it difficult to become pregnant. So we always recommend that. Also, prior to pregnancy, you can undergo genetic screening before getting pregnant at all to see if you're a carrier for any type of rare diseases. So we talk to patients about that, if they come in and say, what are things that I can do now that we're trying?
So when you say a healthy weight, does that mean, and I'm not sure here, if you're too heavy, you might not be able to get pregnant, and if you're too skinny, you might not be able to get pregnant? What is it? What?
Both can be true, for sure. Especially if being largely underweight or overweight typically causes abnormal periods. And those women are a little bit less likely to ovulate regularly, so it makes it more difficult for them to become pregnant. So that's something that can be addressed before trying.
Considering risk, what could women find out before getting pregnant that could be really helpful? I know you said genetic testing, the healthy weight, what else?
Also, certainly if they have any underlying medical conditions like high blood pressure, asthma, diabetes, things like that, lupus, a lot of things, especially if they're not well controlled, that can certainly cause a lot of consequences in pregnancy.
Okay. We have a list of 5 important things a mother can do before becoming pregnant. So let's go through these, starting with folic acid. What is it and why is it important?
Yes, so folic acid is a vitamin essentially that helps sort of control the metabolism and the growth of a fetus very early on. And it actually has important consequences for how the spinal cord and the brain develop. And those actually develop really early on in pregnancy, like in the first 3 to 4 weeks. So it's important to have that on board. So we also tell patients to actually start taking prenatal vitamins while they're trying to become pregnant, so that way they already have that. And then other important things, obviously quitting toxic substances like alcohol and drug use. Making sure vaccines are current is also very important, because there are some vaccinations that you actually cannot receive when you're pregnant. Controlling medical conditions, like we mentioned, you want to enter the pregnancy as optimally healthy as you can. And discussing any medications that you're taking with your doctor, because some things might need to be switched when you're pregnant, because you shouldn't be taking them when you're pregnant.
What about people who say it's okay to have a glass of wine in the 3rd trimester?
So
They laugh collectively.
only because that does come up more than you think.
Oh,
but
yeah,
no,
I believe it does.
We're never going to condone alcohol use during pregnancy. No,
Never.
No.
What about the people who are on their honeymoon and they're whooping it up, and then they come back and they're pregnant and they already had all this alcohol?
Sure. So that actually happens a lot, or more often than you would think.
Right here, guilty.
So with that, if what's done is done, then
Right.
We monitor everything with ultrasounds and with regular prenatal care visits. Unfortunately, there's not really a lot that you can reverse once it's done, but obviously to not continue the use of that.
Well, my kids are great. In that case, it was all right.
Typically, if it's just 1 or 2 times,
Okay, and
typically
it's
going
okay.
to be
Okay, it was a good honeymoon. Okay. I want to go back to folic acid, because this is not only important to take before getting pregnant, but also during the pregnancy. So we have a few ideas for you on getting the right amount. Talk us through this.
Sure. So it's actually been recognized for a long time that folic acid really is critical in preventing what's called neural tube defects. Like we were saying before, just the development of the brain and the spinal cord, and making sure there are no holes actually in the spinal cord. I believe it was the FDA that actually started mandating that folic acid be added to a lot of just daily foods, like breads and cereals are fortified with folic acid. And then in the prenatal vitamin, it has the required amount, 400 micrograms a day, to take throughout the pregnancy.
Are there other important vitamins that you should be consuming?
Yes, in a typical prenatal vitamin, any brand is okay. That's a very common question. Which one should I get? The one at Whole Foods, the one at Costco. As long as it says prenatal on it, it has a minimum amount of folic acid, iron, calcium, iodine, and also lower levels of vitamin A compared to other vitamins.
Okay, and does it matter if you get your nutrients from a supplement versus through food?
I don't think so. It's easier to control how much are you getting through a vitamin. A lot of patients aren't sure if whatever they're eating, does that translate to the required amount. Most people aren't eating the exact same thing every day, so it doesn't matter which source as long as you're getting enough.
And what ideas do you have for stomaching how big those supplemental pills can be?
Yeah, they can be pretty large, and especially for women who are dealing with nausea in the first trimester, they don't exactly help with that. There are ones that are smaller. You
some
kind
are
of have to
chewable.
compare size. Yeah, some are chewable, whichever way you can get it. So try the smaller ones or the chewable ones.
Okay, and I know you touched on this a little bit, but how does folic acid relate to the risk for birth defects?
That is a big factor in preventing birth defects, especially of the spinal cord, things like spina bifida. Another thing that's important is, even if you're getting the correct amount, it's important to mention what other medications are you taking, because certain things like seizure medications, antipsychotics, things like that can actually decrease the amount of folic acid that you're getting.
All right, and so the cause of birth defects range from being preventable to cause unknown. So what do women need to do to improve their chances of a healthy baby? I know that's a broad question.
It is. Like we were talking about before, definitely taking prenatal vitamins, a balanced, healthy diet, optimizing your medical conditions, and discussing any toxic exposures or any medications that you're taking with your physician, so it can all be teetered to what you need.
Yeah.
Okay.
Or certainly if a patient is aware that there's a genetic condition, something that runs in the family, that's important to mention too, because there are ways that you can work with doctors to help to prevent that.
If you have any questions for any of our 3 doctors here, give us a call, 855-796-4475, 855-796-4475. So, between finding out a due date and keeping track of your body and baby's health, regular doctor visits are so important for pregnant mothers. How often do women need to see their doctors during pregnancy?
Overall, it ends up being a lot. At the beginning, it's pretty much from the first month to about 7 months. It's once a month, so every 4 weeks. And then when you get between 7 months and 8 months, 8.5 months, it's every 2 weeks. And then the final month of pregnancy from 36 weeks on, every week.
Every week. That's the exciting part.
Yeah.
The final count. Let's take a look at a recommended schedule broken down into each trimester. So let's go ahead and start with the first one.
Yeah, so 1 prenatal visit each month from the first month to 7 months, and then you move on to every 2 weeks after that, and then every single week until 40 weeks. Lots of, it's kind of funny how for a very long time everyone's like, oh, 9 months is pregnancy. It's actually 10 months.
It is 10 months,
10,
right?
It's 10.
Yeah. Why don't we rebrand that and let people know?
Because usually patients, my guess is they don't start seeing the doctor until they've already finished the first month, because most don't know that they're pregnant in the first 4 weeks because they haven't missed a period.
But we need that.
But it's 40 weeks.
We need the extra month of credit. I mean, for crying out loud. Like 9 isn't enough. 10, come on.
Yeah.
These are all recommendations we just told you for a regular pregnancy. When should someone see their doctor more frequently?
Yes, so those visits, it seems like a lot, but if you have another medical condition, you certainly need to come in more often. Or if a complication or a medical condition arises during the pregnancy, you'll need to be seen more often.
Okay, and what happens if you find out you're pregnant in a later term, so you miss all the beginning stuff?
Later, you just pretty much pick up from there. There are some tests that you actually can't do if it's later in the pregnancy, but for the most part, we sort of pick up from where you're starting.
Okay. We're going to continue our conversation, of course, in just a moment, but I do want to remind you that you can call in anytime if you have any questions. Our number, 855-796-4475. 855-796-4475. The doctors are standing by, and we would love to hear from you, so call at any time. And I want to get into what someone can expect in a prenatal visit. We have a list of some of the common vitals, so let's go ahead and take a look at that.
Yes, definitely. Every time you come in, you're going to get your blood pressure checked, your weight monitored, and after the first couple of months of pregnancy, you start measuring the abdomen because that has a certain normal growth rate. And I'm also checking the baby's heart rate every time because there are 2 patients that come in every time.
Okay.
We also check the urine to make sure that there's no infection that can be underlying, or certainly any excessive amount of protein, certain things that can predict problems.
What's the most common problem that women have? Like, okay, it's a normal pregnancy, but we see this the most.
Nausea and vomiting.
Yeah.
Okay.
Yeah,
All right. Nausea and vomiting. Well,
Nausea
that's just,
I know.
that's 10
Comes
months.
with it.
10 months of nausea and vomiting. Not 9, 10. Yeah. Same. We need the credit. So when do you hear the baby's heartbeat for the first time?
As far as in the office, when you can first hear it, around 11 weeks or so.
Okay.
Yeah. You can actually, during an ultrasound, you can hear it earlier at about sometimes 5, but usually 6 weeks, but just without an ultrasound in the office about 10, 11 weeks.
That's awesome. And when can you find out the gender? 22 weeks?
So usually at the time of the anatomy ultrasound, that's anywhere usually between 18 to 22 weeks, so 5 to 5.5 months.
And what do you look for in the ultrasound? Because I remember doing it twice, and they're like, "Look," and I'm like, "What am I looking at?" I have no idea.
I was taught the hamburger or the hot dog.
The hamburger or the hot dog.
It still stands.
Okay, hamburger. I think we can figure that one out. Right? Okay. So how do you determine a due date?
So a due date can be determined one of 2 ways. If a patient has regular periods, you can go off of when the first day of their last period was.
Okay.
Because usually once a patient gets pregnant, their periods stop. So you can predict a date from the first day of their last period, and then we still always ultrasound patients as early as possible in the first trimester. So if your due date based on the ultrasound measurement of the baby at the time of the ultrasound kind of matches within a week of the predicted date of the last period, then we actually go with the date from the period.
What equipment do you use for a prenatal visit?
It depends what they need to get done that day, but sometimes it's just as simple as a stethoscope and a Doppler machine to check the heartbeat. Obviously, if they're having an ultrasound that day, we use ultrasound, but it's actually a lot of simple stuff. And then blood drawing sometimes.
And do any mothers, are they concerned that the equipment might harm the baby in any way? Or?
So that comes up every once in a while, especially now that there's a trendy thing to buy a Doppler machine to hear the heartbeat at home. And so with those types of things, it comes into question of how often is it okay to do this safely. We certainly recommend that patients actually don't do that because if you ever have a concern at home that you can't find the heartbeat, it's not something you should manage yourself. It's something that we should be managing with you.
Right.
And maybe there's moms that want to do that every single day, and there really haven't been a lot of studies to show is using that machine every day, because it is an ultrasound that can sometimes cause heat waves to the baby, and we're not sure if that's safe. So we actually tell patients not to use that,
That's
and
good
just
advice.
stick to what's in the office.
Okay. What other medical professionals are involved with the prenatal visit?
Depending on if a medical problem pops up, at that point we would actually send them to a specialized type of obstetrician, a high-risk specialist, if they have something like high blood pressure or if we think they're developing preeclampsia or diabetes. Really, any specialist can see a pregnant patient. Sometimes it's they don't like to, but really any specialist can, depending on what's going on.
And do prenatal visits always involve seeing the OBGYN?
At our office,
Yeah.
yes. Yes.
Okay. All right. And how long do the visits last? They're pretty quick.
Pretty quick.
There.
The first visit is definitely the longest, so we can go through everything. Usually they get an ultrasound at the first visit, and we like to meet everybody, meet their family, and we like them to meet all of us. So it's kind of a social visit and gathering and giving information visit, but after that they're pretty quick.
And how long do they fawn over you and the fact that you're three sisters and you all practice together and how fabulous it is? Because I can't stop doing it. So do you get it just regularly every day?
Oh, definitely.
Yeah. Yeah. Oh, it's adorable. Okay, are prenatal visits covered by insurance?
Yes, for the most part, unless you're on a really bare bones plan, maternity care is covered.
Awesome. Prenatal visits are also a good time to connect with medical professionals by asking questions and planning for your delivery. So what are questions that you get a lot besides your personal history and that you're sisters?
About delivery itself, there are a lot of questions about epidurals. Is that safe? Is that something I should do? What about natural deliveries? And what are the expectations during labor?
What about epidurals?
I think they're very safe. Personally, I think that that's one of the greatest advantages to being pregnant in the modern times, especially in the United States, because it's readily available and very, very safe. There seems to be kind of a rumor about long-term paralysis, things like that, and that is pretty much impossible if it's done correctly. I've never seen that. It's very, very safe.
And very helpful.
Yeah.
Yes.
Okay, how can prenatal visits help a mom prepare for having a baby?
Just like you said, it's an opportunity to ask questions, get questions answered. A lot of first-time moms have a lot of anxiety about what's going to happen the second that I walk into the hospital. And so we're able to walk them through that and sort of set the expectation so you can be kind of more calm and excited about giving birth rather than scared.
Right. And what decisions should mothers be making during the pregnancy?
We recommend that they start to look for a pediatrician towards the last couple of months of the pregnancy, because eventually they'll end up seeing their pediatrician more than they see us, and it's really important that they develop a strong relationship and trust with that physician. And so we tell patients to visit different pediatricians' office and kind of get a vibe for what you think you'd be most comfortable with. They also have to decide lots of stuff about becoming new parents, and so we're very encouraging of careful reading on the internet of things to expect just with parenting and just different literature about that.
And so what else can moms expect from their prenatal visit? Lots of advice, lots of vitamin taking.
Yes. Also, just the general screening tests that are recommended in every single pregnancy. We also offer vaccinations, but certain screening at the beginning of pregnancy is for the baby. If they want to do any genetic testing, we do that. We screen every single patient around 6 months or 24 weeks for diabetes in pregnancy. And kind of towards the end of pregnancy, around 35 weeks, we check everybody for group B strep. In case patients need antibiotics during delivery.
Is there any trend that you see more here in South Florida versus the nation? Like, are there any more, because of our population and our makeup, are there any issues that are more prevalent here in South Florida than nationwide?
Everybody wants to know how much weight is safe to gain and how much diet and exercise can play into their pregnancy. So we talk about that a lot, actually. We always like to remind patients that, especially first-time moms, as soon as you tell your friends and family that you're pregnant, everyone's going to want to try to feed you everything. And don't play into that. You're not eating for 2 people. You're eating for you and 0.1 of a person. So you really don't have to eat twice as much as you're eating. And a lot of women just don't even think about that.
So what's a normal, if you start at, say, 120? I wish. 120, and then what's normal to go up to? 25 pounds, 30 pounds, like with the baby in you?
More or less, right. If you're already
Okay.
starting at a normal BMI and a normal weight, then it's normal to gain somewhere between 25 and even up to 40 pounds. Yeah,
Okay.
that's normal.
Okay, and then back on the treadmill. Okay, stay with us because when we come back, we're going to talk about other ways to keep your baby healthy. You're watching the Health Channel, all health, all the time, all baby talk all the time on South Florida's PBS. If you have any questions, please give us a call, 855-796-4475, 855-796-4475. And remember, you can take the Health Channel with you wherever, whenever, by going to our website, allhealthtv.com, and you can watch the Health Channel live stream or check out our videos from previous episodes. We are talking about healthy pregnancies, how to make sure mom and baby are healthy, and dad too, right? We want to make sure dad's okay. But I wanted to touch real quickly on C-sections, because you hear of this more and more people wanting to schedule the births. Good idea, bad idea, safe idea, not safe. What do you think?
There's a lot to be said about that. I completely understand the convenience factor and the planning factor. Obviously, if it's your first pregnancy and people have fears about being in labor and having a vaginal delivery, and so perhaps that's how it started. But in terms of safety, C-sections are a major surgery, and by far vaginal deliveries are safer. Because there's no surgery involved. You can also walk out of the hospital the next day if you feel great, and then with a C-section you're recovering from a major surgery while taking care of a newborn baby at the same time. So
what's better for the baby?
A vaginal delivery as well. There are some rates of babies born by C-section. Hard to explain why. Something about actually passing through the birth canal. There are lower rates of babies who need additional help breathing, things like that.
I heard when they went through the birth canal, it like squeezes all the
it
stuff out of the lungs.
them a little bit.
Is that right?
Yeah, I think that's part of the theory.
I had 2 kids, but I still have that pregnancy brain, so I don't really remember everything. But that's what happens when the baby goes through the birth canal? Okay, and what about a lot of moms who think, I'm going to have a C-section because I don't want to be incontinent?
That's a common thing, or honestly, sometimes they think it'll preserve the vagina, things like that, and incontinence is part of that. But there's evidence to say that any pregnancy where you have a major stretching of the muscles of the pelvic floor, that all of that is a risk factor for incontinence in the future. So it doesn't save you that risk.
Okay. So safe to say, when you all have children, you're not going to have an elective C-section?
Will not.
No. Okay.
it's also a different experience with pushing and having family in the room rather than in a sterile operating room.
Yeah, with a drape sheet.
Yeah.
So you can't move.
Right.
Plus, C-sections have a future risk. In future pregnancies, if you have 1 C-section, you can try for a vaginal delivery. But if you have 2 or more, that is when the risks get higher and higher. If you know that you want to have multiple children, that can become unsafe. There are higher risks of bleeding. The surgeries each time get more difficult and more complicated.
Why? Because you're maybe not
there's
healed all the way?
Exactly. The scar tissue that develops on the inside can get really tough, and sometimes it's hard to tell apart what's the bladder, what's the bowel, and it gets trickier. And not just that, but the placenta can get stuck, a lot of placental disorders that might require a hysterectomy at some point.
Oh, wow.
So all of those risks go up.
But there's a pretty high percentage of people in South Florida comparatively who do elect to have C-sections.
Yes,
We have a pretty high number?
For sure.
We do.
Yeah.
We do.
Yeah, some
Unfortunately,
close by hospitals have the highest in the country, unfortunately.
Okay, and so we in the highest in the country in South Florida. Okay, all right. Well, maybe they'll think about it a little more before they do it. Now, of course, if it's an emergency, you got to do it.
Of course.
Oh yeah. C-sections have their place for
course.
sure. For sure.
Yeah, and they are generally safe procedures. Certainly, it's extremely common, and honestly, odds odds are everything will be fine. But it's to be taken seriously. That's not exactly an equal choice between a vaginal delivery and a C-section, so that needs to be made carefully.
Okay, awesome. Okay, let's talk about vaccines. Having the right vaccines during your pregnancy are important for protecting yourself and for your baby from serious disease. For starters, women getting pregnant should be up to date on their vaccines. What if you're not? Can you take it when you're pregnant, or how does that work?
There are certain ones that are definitely to be avoided. Pretty much all what are called live vaccines should be avoided in pregnancy unless the exposure is so great. You know, a lot of this doesn't come up in the United States, but certain endemic areas. But yes, that's another thing you can find out before becoming pregnant if patients know that they are trying in the next couple of months or year. You can have your chickenpox immunity tested and also your rubella tested, because if you those diseases can also cause birth defects. So that's very important to figure out up front. So if a woman's not immune to that, then you can get that vaccine beforehand and shouldn't become pregnant within the next 2 or 3 months.
So how do women know what vaccines they need and when they need them?
Actually, there are very clear guidelines based on age on the CDC website, and that's where we usually refer our patients to.
Okay, so actually we do have a tool that we want to share with you that can help guide you through this here, and that is that CDC website that you were talking about. They have a quiz that you can take to figure out what vaccine you need, and just in case your mom and dad forgot if you had them or not.
Yeah, it's actually very quick, very simple to use.
Okay, so let's go through some of them. Review the items listed below. Check those that apply to you: alcoholism, cigarettes.
Right. They actually have an option for I'm considering pregnancy in the future, or if you want to travel. And then if you have certain immune issues as well.
Wait a minute. So you check this, and then it tells you need this vaccine?
Yeah. Yeah.
And it's accurate.
Oh yeah.
Okay, let's look.
This is the most accurate you can
Are you
get
male or
from the
female? Okay,
CDC.
that's informative. What year were you born? Were you traveling outside the U.S.? Do you have a weakened immune system? Do you have HIV? Are you a first-year college student who lives in a college dorm? Now, what does that have to do with anything?
Meningitis risk.
Oh, meningitis. Oh, okay. All right. So this is thorough here. Okay, this is fun. Are you a first-year college? Okay, we did that one. Are you resident in a nursing home? What does that tell you?
Oh, you're exposed to a lot of
pneumonia.
Yeah, certain types of pneumonias and other bacteria.
Okay. Do you work with patients in a doctor's office? Okay.
Flu vaccine.
You have any of these medical conditions? So then, like, for example, once you do this, and then it'll check up, you need these 3 vaccines. That's how it works?
Yeah.
Oh.
Pretty simple.
Pregnant or not, male or female, yeah.
Wow. That's great. That's great. It helps you guys along.
Oh yeah.
Here, go take this. Go ahead and tell me the website again. It's cdc.com. .gov, cdc.gov,
Yeah.
thank you. Okay, so cdc.gov, that's where you want to go to take this. This is pretty cool. How long has this been around? Is it pretty new?
Probably that I don't know, but
Don't know.
I think since my kids are 6 and 8, I don't remember hearing this when I was pregnant. It's amazing how much stuff evolves in such a short amount of time.
absolutely.
Baby should sleep on the stomach, baby should sleep on the side, baby should sleep on the back. Oh no, back to the stomach. So where are we now? How should a baby sleep? On the side?
I think it's
Side?
on the back.
They're like, oh, that's after our job.
Ask a pediatrician.
Ask a pediatrician. Okay, we're going to talk more about all of this, but we do want to remind you that you can call if you have any questions. 855-796-4475, 855-796-4475. We are standing by live, and we would love to hear from you. Well, the whooping cough is another important vaccine for a pregnant woman. So is the flu vaccine, right?
Yes, absolutely.
Okay, and what other vaccines are important as well?
that would depend on a patient's individual medical history and their exposures. But for the most part, the whooping cough vaccine and the flu vaccine is generally recommended for everybody.
What about some of the people who they just elect to not take vaccines for whatever reason?
Mm-hmm. Yeah, that's actually a very frustrating topic to discuss.
Is it? Or is it pretty black and white? I mean, the science says what?
It's frustrating because there's a lot of misinformation out there that is not scientifically based. Vaccines have been around for ages. They've protected millions and millions and millions of people worldwide. They've eradicated some really horrible diseases. And unfortunately now there's been a movement of anti-vaxxers, and it seems to be targeting newborns and children specifically because they become more vulnerable to these otherwise preventable diseases. We get patients every once in a while that choose not to vaccinate their children, and sort of as a consequence, they choose not to get vaccinated when they're pregnant as well. And it's just not really based on a whole lot of stuff.
Bad idea.
Bad idea.
Okay.
Bad idea.
Honestly, yeah, of course, it's always their choice, but it's not recommended. Schools also require a lot of these things. I'm not sure where a lot of the bad reputation comes from. I think it's a lot of fear that is not really based in a lot of science.
So you would get all your vaccines and you would vaccinate your
Absolutely.
children, right? So don't you always ask your doctor, what would you do with your child, right?
Yeah,
and then
right.
it's very telling because
Absolutely.
they usually know more than
Yeah.
us, right?
And
What are some vaccines that you should stay away from? Anything in particular when you're pregnant?
There is a specific flu vaccine that is live. It's meant for children. So the live flu vaccine, do not get that one.
right.
That's
That
the
one's
one that's
given.
intranasal.
It's intranasal, yeah, so it's pretty clear what's the difference.
Okay, good information. One thing we have been talking about is about staying healthy and getting the right vitamins. What are some ways mothers can eat healthy during pregnancy? And do you up something? Do you up the protein? What do you do?
As long as there's a good balance, and certainly if a patient is already eating a lot of foods with high fat concentrations, things like that, and isn't getting a good balance, or a lot of simple carbohydrates like white bread, things like that are not fortified otherwise, yes, it's recommended that you eat a bigger variety. Certainly more green vegetables, that's definitely where you get a good amount of iron and folate, things like that. And fruit, certain types of fish are safe to eat in larger quantities, and yes, lean proteins.
Why is it so hard to lose weight after you have kids?
Less
I say discerningly.
Yeah. Well, you certainly have less energy and less
Okay.
time because you're
More
taking
stress.
more stress because you're taking care of children, and you also just gained a large amount of weight rapidly, and so that kind of takes a long time and is a
Yeah.
little more challenging to
Yeah.
lose.
Breastfeeding can help patients get back to their
Absolutely.
pre-pregnancy weight earlier. Breastfeeding is a high calorie demand on the body, even like depending on how frequently you're doing it, 300 to 500 calories a day. So that's a good way to go back
to help.
before. Yeah.
Big proponents of breastfeeding. Good for
Yeah.
baby.
Yeah.
Okay. And what are some good exercises you can do while you're pregnant? I know some people are like full on yoga and they want to stand on their head and it's good for the baby. And yes, no, maybe.
Yes, yoga is very safe. Hot yoga, stay away from, especially in the first trimester, because that temperature is a little bit too hot. But otherwise, yes, yoga especially has been studied up and down, all types of positions with ultrasounds on, during, before, after, and yoga is very, very safe. Most exercising is generally safe, especially if you're already used to that beforehand. You know, you don't have to start training for marathons if you've never done that before, but running is perfectly fine. And doing things safely. You know, don't put yourself in a position where you could fall and hit your belly. Like horseback riding, if you're already a professional horseback rider, sure, do your thing, but don't start that because you could fall.
I'm pregnant. I'm going to take up horseback riding.
Right, and right. Just to emphasize, doing exercise safely. So in Miami, pretty much no water sports, no water skiing, things like that. No kickboxing.
Yeah, scuba diving is also not safe.
Or if you think you would injure yourself.
So what's the best way to kind of modify some exercises while being pregnant?
Perhaps no. I don't know how many pregnant patients are planning on doing this, but really heavy weights overhead, like powerlifting, things like that. We have some patients who do CrossFit. I would say kind of take it easy on the heavy weights overhead, and making sure that you're not pushing yourself too much at any point where you would fall over and hit your belly.
So it's really the weights that are the concern, not the jumping or moving upside down if you're used to it.
Yeah,
Right. Yeah, or certain medical conditions also are things that develop during pregnancy. Patients who have really high blood pressure, they should avoid really intense activity because that can make your blood pressure even higher. And that's something that we can discuss as this comes up. But otherwise, making sure don't lift something that you could drop and hit yourself with. Just general safety, heavy weights overhead.
Okay, fine. We got about 90 seconds. Tips before we go. Bottom line.
Well, I actually think one of the bigger challenges is getting patients to start exercising. Most patients are not these big exercising junkies when they come in pregnant for the first time. So I usually recommend to those patients, start now, before your body gets larger and more uncomfortable to do those things. And once you start the habits in the beginning of the pregnancy, it'll be easier to continue them. And then it'll be easier to continue once you've had the baby and need to lose the weight. So even if you start with just brisk walking for 30 minutes a day, that's usually what we start with, and then continue that the whole pregnancy. You'll feel better, you'll have more energy, and then you'll have that when you want to lose the weight afterwards too.
Get that walk-in stroller ready.
Exactly. Yeah.
All right, Doctors Bedell here, Victoria, Sarah, Joanne. Thank you so much.
thank
You
you
all
for
are a
having
pleasure.
us.
Thank you so much. Be sure to join us next time on the Health Channel, All Health All the Time on South Florida's PBS. Follow us on Facebook and Twitter using the hashtag All Health TV. And please be sure to visit our website, allhealthtv.com, where you can watch the Health Channel live, like right now. And you can watch videos from previous episodes as well. I am Cynthia Demos, and I'll see you next time.